Welcome back, everybody. We are talking about public health jobs, and in particular, today we're going to be talking about public health jobs in the United States. And we'll dip into sort of some of the usual global health discussion. As always, you can ask questions, and I'm going to start before we carry on asking AJ Perlman a question, and I'm going to introduce her in just a second. AJ, who should be thinking about careers in public health?
Everyone. What I would start with is there is a role for everyone to play in public health. If we learned anything from the pandemic, it's that public health affects all of us at all points in our careers and in our lives. And so I really think this is something that folks can consider. There are so many different opportunities to participate in public health and so many different career pathways to choose that there is a role for everyone to play.
I completely agree. And I have a good friend of mine who's an artist, and she sells art, and the proceeds of her art sales go to financing HIV orphans' education in Africa. So that's a good example of a completely obscure kind of career and interest that's been sort of directed in sort of the public health direction. I've always said, if you're an astrophysicist, and funnily enough, a friend of mine who's a fellow kind of consultant in public health medicine here in Ireland is actually studying astrophysics. I don't think she's doing it for the reasons that I'm thinking at the moment. But the point is that we need to be thinking about mass coronal ejections and what that may impact on health systems. For example, if you're an engineer, we need to get clean water all over the shop. If you're a logistician, we need to get the supply chain of treatments and diagnostics into the right hands of the right people at the right time. Whoever you are, there's a role for you in public health. So I absolutely agree with you, AJ. And before we carry on, AJ, I wonder if you would introduce yourself, tell us who you are, what you're about, and importantly, tell us a little bit about Public Health Americorps.
Oh, well, first of all, thanks so much for having me today. I'm really excited about this conversation, excited to talk with you. I'm AJ Perlman. I'm the Director of Public Health Americorps. And I'll talk a bit about Public Health Americorps in a second. But let me just say, I have somewhat without even knowing it, built my career in public health. I don't know that when I started out, I actually thought about the work that I was doing as public health. Right out of college, I worked in mental health, and I did research with kids with anxiety disorders. And so at the time, I did not think about that as public health, but
Yeah.
it was.
Uh-huh.
And I'll also just note that I do not have a degree in public health. I am a lawyer by training, which has been incredibly helpful in terms of the role that I play in the career that I've had working in the federal government here in the US.
Yeah.
So, all to say, career pathways go in all sorts of different directions, but
Exactly. Even lawyers. Yeah.
even lawyers, exactly. So, what is Public Health Americorps? Public Health Americorps is actually a partnership between Americorps, which is a US federal agency, and the CDC, which I am sure that you're all familiar with. And the partnership really grew out of the pandemic and this realization that there's a role for everyone to play in public health. Americorps is the federal agency for service and volunteerism, and Americorps has a long history working deep in communities to be able to support whatever the pressing needs of communities are. And what Public Health Americorps was built on was really the idea that we could use national service and use a year of service as an opportunity to sort of have an on-the-ground experience and training in the field of public health, while at the same time responding to the needs of local communities.
Yeah.
So building upon, CDC's expertise as the leading public health agency, and we're using CDC's experts. We're engaging CDC in trainings, but also, again, with Americorps, reaching deep into communities and engaging individuals in that year of service.
So it sounds like Public Health Americorps would be an excellent stepping stone for a person who wants to venture into public health. Well, maybe even, and tell me if I'm wrong, AJ, but maybe a person who's already been working in public health in some shape or form, that's looking for a change or wanting to kind of diversify or get a little bit of a different experience. Public Health Americorps would be an incredible place to take a look. And as you say, there's all sorts of opportunities. I'm going to actually, would you mind if I play one of the testimonials from
Please.
one of the people that has actually got experience with Public Health Americorps? And for people that are watching, just so that you know, at the top on the left of your screen, there's a little QR code. If you scan that into your phone, you can submit video questions or video comments, thoughts, something about public health that you love, and then we'll be able to bring those up in subsequent live sessions like this. Also, just while we're talking about it, there is a chat function. So if you're watching this on LinkedIn or on YouTube or Facebook, you can put comments and we'll see them here. And once there's a few more comments there, we're going to come back and address them and read them and respond to them, et cetera, et cetera. So pop your comments in. We're going to try and get to as many of them as we can during the session. Okay, but without further ado, here's a very short 20-second video of somebody that's worked with Americorps, Public Health Americorps.
My 5-year goal is to be a licensed therapist. Americorps has actually given quite a lot of opportunities for career advancement. I think the benefits to joining Americorps are the amount of people that you can meet and the connections. Americorps can find a situation for you that has you working closely with the people that would help your career. The people that I've met through this program too are going to be lifelong friends.
I really like that. He's the sort of guy that I'd love to meet one day and say hi, give a high five. Like I love these sort of testimonials. So keep the questions coming in the chat. Scan in the QR code. One more thing, if you want to, we've got a QR code that you can also scan in. I'm just going to pop it on the screen now. Show, and that'll take you to the Public Health Americorps page. Or of course, you can just find it online, Public Health Americorps. You can't miss it. It'll come up in any Google search. I'll leave that on the screen just for a second or two. AJ, can I just ask you, in your view, what are the opportunities in public health going forwards? Where are the sort of, shall we say, growth areas? What's going to be happening in public health in the immediate future? If you're a young person getting into the space, what should a person be excited about or looking forward to in the public health space?
So much. Here in the US, we understand that we need 80,000 more public health workers to be able to provide core public health services across the country. Mm-hmm. And I just think there's such an incredible opportunity for things like community outreach and education, making sure folks understand how they can take care of their health, getting connected to services, getting connected to healthcare. There are roles for folks to play as navigators. I think there's a ton of opportunity when it comes to data analysis and research. Yep. The more information we have, the more opportunities we have to be able to address our health issues and our health disparities. So absolutely. I think there is a wide range of opportunities. We do need more public health workers. And there's just a real opportunity for us to think about how we can think about public health in terms of community focus, right? I think oftentimes we think of public health as a role of government, but there is a role for government and for community and for those partnerships between. So I think that's really important.
Yeah, absolutely. That's interesting. And so Public Health Americorps has this very kind of broad view of public health and the different ways and shape in which people might get involved. That's interesting. That's it. I'm going to have a quick look to see if we've got questions popping in, and I'm going to put them up here just so that we can read them together. So we've got, it says, I agree, global health problems are beyond vaccine development and also problems such as optimal cold chain and transportation. I'll just quickly respond to that. Yes, absolutely. A big part of public health, and I kind of really got to understand this when I worked for a little while ago at the Clinton Health Access Initiative, was about getting the right things to the right people at the right time. that whole, everything from demand forecasting, procurement, shipping, the whole supply chain management, warehousing, distribution, inventory management. And people don't think of those as public healthy kind of things. They're very practical, they're very kind of like hands-on, get this physical thing into the hands of that physical person over there. But that really is what saves lives at the end of the day. Now, and underpinning that is an understanding of epidemiology and some of the science of public health. But you don't need to know all of that science to get involved. You know what I mean? You can, if you're a person that's really good at understanding supply chain management, oh my goodness, you are an asset in the public health world. So optimizing cold chains for transportation, absolutely a huge thing. I completely agree with you. I'll just pop another question up. I'm focused primarily on epidemiology during my master's. Would public health Americorps be a good fit in helping find an opportunity? AJ, over to you.
Yes. So one thing I'll say, before I joined Americorps, I was the chief of staff to the COVID response at the Department of Health and Human Services. And yes, we were so focused on getting vaccines to communities in the early days of the pandemic when the vaccines became available. And I will just say the process by which you get the vaccines from where they are developed and made to getting them in people's arms, there are a lot of people involved in that process, and all of those folks are contributing to public health. So just another +1 for supply chain, for logistics.
Yeah, double thumbs up.
There's a role there. So just in terms of would Public Health Americorps be a good fit? We, I initially thought about Public Health Americorps as a way for early in career folks to get a taste of what working in public health could look like. So the only requirements to participate are that you be 17 or older, that you be a US citizen or a legal permanent resident, and frankly, that you're able and willing to learn and serve. So those are the only requirements. But what we have found is that we have individuals who are serving across their lifespans, whether they're new to the workforce, brand new, early in their career, or they have their master's. So for this person, maybe they have their master's, but they are looking for additional work experience.
Yeah.
Public Health Americorps is a great opportunity to get that work experience. Yeah. And our members have found that doing a year of service actually helps with their professional networks. So they're able to not only get that experience, but they're also making connections. And for those Americorps members who have worked, for example, in health departments, sometimes bureaucracy is difficult to navigate in terms of getting jobs. Having that experience, meeting those people, working with them has helped them get into the system and get those jobs. So Public Health Americorps can absolutely be a stepping stone, regardless of where you are in your public health education.
Yeah, and AJ, I will tell you that having been in this conversation with people for many years about how do I get into public health, one of the biggest questions people ask me is, if I don't have experience, how do I get experience? Because all the jobs out there have this requirement that you have experience, and I can't get experience because I don't have the job. I can't get the job because I haven't got experience. I mean, you are literally talking about an answer to the question, that I get asked more often than anything else in these conversations about careers in public health and in global health. And if you're interested in global health, getting experience in the States with Public Health Americorps could be an excellent stepping stone into a global health career. So, see this as a stepping stone and experience that you could use to take you in almost any old direction. So that's exciting. There's a nice, let me just see, I just saw a nice little comment here saying, good morning, everybody. I agree with AJ. So excited about starting public health education. So very good. Another question, and this is probably more for yourself, AJ. Mid-career, is there an age limit? Where are the opportunities located? Remote, federal government hospitals? Thanks.
Great. Morgan, I feel like you set me up for this question. So our Americorps members range in age from 17 to I think 82 right now. So no age limit. We welcome all comers. And like as I started out with folks, learning about public health in the pandemic, we have a number of folks who became interested in public health because they served as a contact tracer early on in the pandemic, or they decided, hey, this could be interesting, let me think about a career switch. And so folks are using Public Health Americorps as an opportunity to explore a career pivot. Where are the opportunities located? We have Public Health Americorps programs that are working in almost every state across the US, as well as in Guam, Puerto Rico, Washington, D.C. So there are opportunities to serve both in urban and rural locations. And the opportunities are with public health agencies, with community-based organizations. We have some Americorps members who are serving in schools. We've got folks doing capacity building work, so sort of helping organizations or public health agencies build skills in particular areas, responding to survivors of intimate partner violence, or doing more training around suicide prevention and intervention. Really, the opportunities are out there, and we'd be excited to have folks explore more.
There's another question here, which is probably also good for you to answer and not me, AJ. Can I work for a short time? Is there a time limit that a person has to work for?
Yes, so there are both part-time and full-time opportunities to work with Americorps. The full-time opportunity is a service year of about 1,700 hours, but we have half-time positions, quarter-time positions, and the reason we've done it that way is both because we know you all have other responsibilities. Maybe you're in school, maybe you have family, maybe you have another job, and this is an opportunity for you to explore without too much pressure, explore an opportunity in public health. And on the other side, we know that communities have different public health needs, may not require, depending on the role that you're playing as an Americorps member, it may or may not require a full-time role.
Okay, thanks very much. Here's a question. I'll give a short answer to this. And this is actually part of probably a bigger discussion, and we might carve out some time in another one of these live sessions to really kind of get into the nuts and bolts of a DRPH. So people interested in public health and a career in public health often do one of a couple of things: a master's in public health, a DRPH, which is kind of a little bit more academic, so it's kind of bordering on a PhD, but it includes quite a sort of a practical component of it. And I think graduates of DRPH programs are very hireable. So if and then of course there's the PhD. I don't want to get into a long discussion about which is best for you. I will say, however, that if you've got a bit of an academic slant to you and you're interested in publishing, or you're interested in working either in or in collaboration with academics in university settings, a DRPH is an excellent fit. It'll set you up for that. It's not an easy thing to do, so don't just jump into it willy-nilly. Think about the extent to which it's really going to add value to your career trajectory. But I don't want to get into a long discussion about that today, just because I think actually that deserves almost like an hour session where we really get into the weeds of education and what are the best stepping stones for the different possible career trajectories that you might land on. I don't know if you have any thoughts on the DRPH question, AJ.
Maybe I'll just say, let me know when that session is happening, because I'd like to join. As a lifelong learner, I am also always considering a DRPH. So
right, yeah.
No, I think that you hit the main points, which is really thinking about research and publications and kind of taking that bent. So by all means, if that is an interest of yours, I would encourage you to pursue. Don't go into it lightly. And at the same time, I would say it is not necessary to have a successful career in public health without without a DRPH.
Yeah, agreed. I'm going to play another quick sort of 20-second testimonial because I love these testimonials, by the way. And I think people watching will as well. So everybody have a look at this.
My name is Lucero Plata. By serving in Americorps, I take all the training and I become more aware about the public health and more interested. So how I see myself in 5 years is probably working for the public health because I see all the needs. I'm not rich, but I have so many things to give for my community, and I know some people struggle, and I want to help them.
Again, just lovely. Just somebody that I hope one day I get to meet in some shape or form. There's a interesting question. I think it might be this one. This is, I think, a question that just talks about a person that's not in the US and what are the options in terms of getting involved. I recently graduated with an MSc in global health. Currently working as a research associate in India, and I wanted to know about opportunities in the USA. More like how welcoming the industry is towards immigrants. Also, my degree is from the UK. What would you, and we didn't get the rest of that question, but I suppose it's what would you advise, or what are your thoughts? AJ, do you want to kind of lean into that one?
Yeah, sure. You know, what I have found interesting is that through Public Health Americorps, we have a number of folks who have served in the healthcare or public health field in other countries, and they have brought their expertise to the US and used Public Health Americorps as an opportunity to really explore the culture of public health in the US. So it's interesting because we think about Public Health Americorps as an opportunity to learn the skills. But I have a number of members who have said that they were a surgeon in Qatar, and now they're a public health student here in the US, and they're participating in one of our Public Health Americorps programs. I have an individual who's an Americorps member. She came from Nepal and worked in public health there. And again, she said her interest in Public Health Americorps really stemmed from getting into the US public health system and really understanding it better. So I do think there's opportunity for folks who come to the US from other countries to participate. And I think there's real interest. You all bring incredible skills based on your lived experience and your roles in other countries. And I think the field would welcome that.
Yeah. On a similar vein, and I'm not surprised that we're getting questions from, all over the world, because that's, we're living in a global world. The question from Mark is, will my qualifications in public health be recognized, even some degrees in the USA? And I mean, my instinct is the answer is yes. And I know that because I have lots of friends that graduated with me in public health. I studied public health in London and that are currently working in the US without a problem. Some of the time, if you have a medical degree, so to be a licensed clinician in the US, you've got to jump through a couple of extra hoops. That applies in any country. I moved to Ireland and I was registered as a doctor in the UK. And, in that particular instance, it was just like a mountain of paperwork. But this is different. Public health, if you've got a master's in public health, there is a sort of recognition of that, I think, all over the world. And so, AJ, any thoughts on that? But I'm assuming that that's about right.
I think that's absolutely right. And again, I would just draw towards your experience, which is incredibly valuable, regardless of your qualifications and whether or not they transfer. I do think that your experience working in health or public health can be incredibly valuable. And so I think talking up that experience and those skills can be beneficial if or when you're exploring potential opportunities.
Absolutely. Another question that's come in, and I'm a doctor interested in pursuing public health program. Particularly, I'm looking for a scholarship-based program. Any suggestions on how to proceed? And I'm interpreting this as I'm interested to pursue a public health program. I'm not sure if the question is about studying public health and getting a scholarship to study public health, or a public health program? I'm guessing that is the question, because it's about scholarships, which usually revolve around some sort of academic program. I tell you what, I'm gonna, if this person goes to my little website, which is learnmore365.com, and register for free. You can go to a resource library, and on that resource library, I've got PDFs that have got like a cheat sheet on how to get a scholarship. So go there. I will, in subsequent episodes like this, kind of dig into that a little bit more deeply. I think it's not an uncommon question. People wanting to study further, but it's often prohibitively expensive unless you can get some help. So completely understand. Yeah. No.
Maybe if I could just jump in real quick on that, to say, I think this question was getting at scholarships, but one note about Public Health Americorps is, in addition to just the on-the-ground experience and training that folks receive, at completion of your service, you do receive an education award that can be used to either pay off student loans or to take that next step in education. So some folks who serve in Public Health Americorps really get that taste of public health through their service experience, then go on to pursue a bachelor's or a master's in public health using that education award as a starting point.
Very interesting. The other thing is, if you're wanting to apply for a scholarship, scholarships tend to be a little bit competitive. And if you've got that experience, in other words, you've worked with Public Health Americorps and you can point to a real example of work that you've done, you've demonstrated a commitment to public health and interest in it, I think you become a much stronger candidate to get that scholarship. So, this could be a stepping stone to so the nice thing is you can work with Public Health Americorps without the MPH, without the degree, get the experience, use that as a stepping stone to getting a scholarship, which will then also sort of contribute to you studying further. So, this is, I didn't really know much about Public Health Americorps until you and I started speaking. And I wish I did, because this is a question, how do I get into this is a question I get all of the time. So
Yes.
This is extremely useful. Another question that's popped in here is, does Public Health Americorps work with Doctors Without Borders, or MSF? Is there any overlap there? Is there any collaboration? Is there?
We don't currently have a collaboration with Doctors Without Borders. Again, we are U.S. based specifically, and doing the work here in the U.S. But Doctors Without Borders is a great organization that I'd encourage anyone who's interested to look into to do so.
Okay. Now, here's a nice general question. So this, this is, as someone who's just getting into public health, do you have any advice as to what kind of experience could be useful? I'm currently I don't know what that is, Matthews, must be at, and I'm unsure of what I want to focus my career on. So it's an interesting question. And again, this could be a long conversation. Let me give you 2 cents worth, and then AJ, you jump in there. I think if you're early on in your public health career, it's a good idea to try and get kind of some broad experience, get a sense of the what's out there in public health, because there's a lot. There's so many nooks and crannies, so many different aspects of public health that you could get involved with, both in terms of subject matter. So there's communicable disease, non-communicable disease, blah 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 blah. There's a million niches in terms of disease areas or preventative areas that you might want to get involved in. But then there's also kind of so many different skill sets and professional directions you could also go. And you want to kind of get as much kind of exposure as possible before really hunkering down and finding your, that will help you get your niche. I would say this, that underpinning almost everything in public health is epidemiology. So, people often ask me, in terms of studying, what should I focus on? If you never learn statistics, that doesn't matter. It's great if you learn it, doesn't matter if you don't. Epidemiology, you need that if you really want to kind of lean into a serious public health career. And so, getting some experience that helps you better understand epi, I think, would be also a very useful starting point for anybody that's early on in their careers. But AJ, any thoughts there?
So you touched on the biggest thing, which is explore lots of different opportunities, right? It's okay that you don't know where you want to focus your career yet. But there are so many different ways. I think a masseuse is someone who maybe gives massages, which just led me to, thinking about the physical body and thinking about how to help people. And I'll tell you one story. It's one of our videos that we didn't send to you, Greg, but there is an Americorps member named Julie who is serving in Wisconsin, and she's a person who is living in recovery, and she found out that physical activity and exercise really helped her with her own recovery. And through that process and through Public Health Americorps, she has started a program called Sober Strong, where she is supporting women in early recovery through exercise classes and one-on-one counseling. And she's even opened a clothing closet if folks need exercise clothes to participate in the program.
Fantastic.
You know, that's the kind of thing that we don't think about when we think about public health, but she is right there working with, I think, 30 plus women now in recovery. And she has just not only seen their recovery move forward in a positive direction, but it's really helped her as well. So just one example of many different ways in which you can contribute or explore based on your own interests.
Brilliant. That's very, and what I'm going to do before we come back to the questions, I'm going to play one more video. And this is actually somebody that I know that I studied public health with when I did my master's in public health in London. And she just sent me a video from her phone using the little QR code that's on the screen at the moment. Just giving a quick nutshell of her career in public health and global health. And she's landed up working at the World Health Organization. And I get that a lot. Like, how do I get a job at the WHO? Well, okay, watch this little video.
Hi, everyone. I am Dr. Kende Craig from Nigeria. My first contact with Public Health Service was when I volunteered for the polio eradication program. Thereafter, I enrolled in the LSHT and Public Health in Developing Countries, and again volunteered to work with the CDC in Darfur, Sudan. When I returned home, I worked with an EU project on immunization. Thereafter, I moved to the World Health Organization, WHO, which had been a lifelong ambition for me. Believe me, public health is awesome. I'm loving it.
Okay, and I love that little testimonial. I think it's great, and of course, I've known her for many, many, many years. And so, you know, I met her. We did our masters in public health together in London. So it's so nice to have seen, you know, the way her career path is. And it started off doing volunteer work, which is great. You know, she got that experience. So interestingly, she sort of followed the path that we talked about a few seconds ago. She did volunteer work. Off the back of that, did a master's. At the end of the master's, again, did volunteer work. And I know that people struggle sometimes. They get a master's in public health and they sort of imagine that they'll just walk into a job, and sometimes it's difficult. So she redid some volunteer work, and then she's done brilliantly and is now working at the WHO. So really, really well done. I think that's a really nice success story. I see I'm just going to put it on the screen. I love epidemiology.
That's great. That's great.
So that's really nice to see. I don't know if we had this question up. We may have had this. Have I done this one? I'm a postgraduate diploma from Canada. At this stage, I'm thinking of work in public health, but I was thinking without a master's, it would be hard for me. Any leads? Well, this is a nice example. Is you don't need a master's if you want to do work with Public Health Americorps. But you know, she's in Canada. She may be she might not be a citizen in the US or be a resident and eligible to work with Public Health Americorps in the first instance. And I would say if you've done a diploma in public health, and I see from a subsequent question that she's put in the comments that it was in public health, and you're looking to get that experience, Public Health Americorps, AJ, you might be able to tell me, is there an equivalent in Canada or in other parts of the world that you're aware of? Or is there anybody else in other parts of the world that offer a similar program? Or is what you're doing quite unique?
I am not aware. That doesn't mean it doesn't exist. It just means I'm not aware of it in Canada. But what I might encourage for this particular individual, well, two things. One, just volunteering, and starting with volunteering is one way to get in and just explore opportunities. But two, I might also suggest thinking about community-based organizations that are doing some of this work already. We don't tend to think about community-based organizations as doing public health, but let me give you just a couple of examples. We work with the American Red Cross, and our Public Health Americorps members are building that capacity within the Red Cross's structure to help prepare for disasters. So whether that's recruiting new volunteers to participate in disasters, that's public health. The American Heart Association we work with, they are having AmeriCorps members teach individuals in rural communities how to take their blood pressure to address to sort of support chronic disease prevention. And kind of what are those opportunities to work with some community-based organizations? We also have local organizations like Baltimore Corps in Maryland, where folks are our AmeriCorps members are being trained as community health workers. And what we are finding is that it is those connections between members who reflect the communities in which they serve and the people that they are serving, that is really not only making a difference in the lives of the AmeriCorps members and the people they're serving, but is also having an impact on their communities. So I would just encourage thinking about whether there are community-based organizations in your area that may be interested in engaging you or may have jobs available.
Right. That is interesting. And I'll just add to that, if you're brand new to public health and you're struggling to find that first opportunity, consider doing an internship. Increasingly, a lot of these big organizations will provide paid internships. Right now, it's often not a lot of money, but it's to make it, that it's not crippling to do the internship. It's a great way. It's similar to doing an experience with Public Health Americorps. It's a great way to meet people and to network. And it's those relationships. I did an internship at the WHO even before I did the MPH, and I'm still good friends with people, and they actually are part of my professional network. This is like 30 something years later, still part of my professional network that I reach out to and I'm in contact with all these years later that I met back then, in 2002 or ish, when I did the internship. So, think of doing an internship, think of volunteering, think of just doing anything you can to get that little bit of experience that you need to kind of as a stepping stone to your first kind of proper job. So that's, I always just sort of say, do, and sometimes I also say to people, just try and make something yourself. Start a little charity. When I was in Africa, I started a little charity called Books for Africa. We were trying, I tried to start a radio station for HIV positive people. That didn't work, but I tried. But actually, funny enough, the process of trying it, and actually I even got funding for it and everything, and there was just too many sort of regulatory hurdles. But the process of trying to get that radio station up and running just turned into an incredibly useful networking opportunity. I sort of made all sorts of professional contacts, and I'm still, again, in contact with some of those people to this day, sort of 30 years later. So try and do things. I started an academic journal. People think it's difficult to start something. It's actually not. Get an idea and you talk about it, and you just need to bump into one other person that thinks it's also a good idea, and suddenly, the whole thing gets a bit of momentum. So think of starting something. Start a blog, start a podcast, start a YouTube channel. There's a million things you can do that doesn't take money, but it could be pointed to as experience, potentially in some shape or form. I'm going to play one more short video. Also, again, just somebody talking through their experience in public health. In this case, it's a medical doctor. So I know some of the people that watch the show are doctors. So I'm just going to play this, and then we'll come back. And then I've got one AJ, I'll set this question up for you before we even get there. I'm going to ask you, what is your favorite part about being the director of Public Health Americorps? Okay, so you got some prep time.
Hi, my name's Matthew Harris. I'm a clinical reader in public health medicine at Imperial College London, director of postgraduate taught programs in the School of Public Health, and an honorary consultant in public health medicine in the NHS. But I started off my career in public health actually working as a general practitioner in the Brazilian family health strategy in the northeast of Brazil, in a small clinic in the state of Pernambuco in 1999 for about 4 years. And then I moved from there into global public health, working in Ethiopia and Mozambique before coming into the academic public health space here at Imperial College.
Okay, and that was Matthew Harris, and I happen to know him as well, and he's got a book out on what's called reverse innovation. So it's lessons that can be learned in the North from the global South in terms of healthcare systems and public health. So very interesting fella. So thanks very much for that, Matthew. Okay, and just a reminder, the little QR code that's up there, scan it in, use your phone, and you can send me questions, but also send me your path, your path in public health, or you can send a little message saying, hey, I'm working here or working there and I love it. Send that. I'll put it on the screen. It'll be a lot of fun. AJ, your favorite part of being the director of Public Health Americorps?
How much time do we have?
Oh, we've got time.
No, I love doing this work. And my favorite part is being able to see the impact that our Public Health Americorps members are having on their communities, and the impact that this program is having on our Americorps members as individuals, and the ways that it is changing how they think about public health, how they think about serving their communities, and how they're really planning to take this experience with them long into the future. So I love being just a small part of their journeys and their communities' journeys, and being able to tell the stories at a level at which we can continue to have impact through this program. So we've got more than 5,000 people who have enrolled in Public Health Americorps already.
Wow.
We have over 2,500 alumni through the program. And so in just, less than 3 years here, we've seen a real impact all across the country. So very excited about this, and looking forward to see how all of these folks become the public health leaders of the future.
That's fantastic. I think that's a good place to end. I saw a question coming in asking me to put the QR code back on the screen. You can scan in that QR code. It'll take you to the Public Health Americorps page. And there's lots of great information there as to how to apply, et cetera, et cetera. AJ, thanks so much for coming on. Please come again. This has been so nice having you here. You bring so much to the conversation. Any last words?
Thanks so much for having me. If you do have that conversation around the DRPH or academic pathways, I'd love to listen in and also share with our Americorps members. And in case you, for some reason, can't access the QR code, you can learn more about the program at americorps.gov/public health. Thanks so much, Greg. I had a great time with you.
Okay, thanks a lot. Thanks everyone for tuning in. Thanks for all your questions. Keep them coming and don't ever change.